Hi, everyone. My name is Melissa Jean Jarzynski. I am a physical therapist. I am a board certified hippotherapy clinical specialist, as well as an equine specialist in mental health and learning with Path International and an equine specialist with EGALA. So what does any of that mean for you guys? It just means I've made my professional career partnering with horses to help individuals on many different levels. But where I hold the most amount of knowledge is in my hippotherapy, which is a career path that I chose in 2005 and have just continued to grow and learn this entire time. And right now I see so many people out there looking for these services and therapists looking to learn how to provide these services. And so here I am to help you guys along the way. So I'm going to just put up a screen here and we're going to get started. I hope you enjoy. So today we are going to be talking about the non-traditional riding positions that we use in hippotherapy. And I say some of them are the non-traditional, the backwards and the sideways, but mostly it will also be forward. And before we get started, of course, I have to have this disclaimer. All of these sessions were done by myself, who is a medical licensed provider who has spent a great deal of time studying and learning to make sure that I know how to incorporate equine movement into all of my sessions. Please do not just attempt any of this with any horse. These are really trained, specialized horses. And also don't try it if you just don't know what you're doing yet. Make sure you have the training. There are a lot of different organizations, associations, as well as other therapists holding mentorship opportunities. So if this sticks with you and you feel like you have the bug that you want to pursue, fantastic. And if you're a parent who is looking into hippotherapy, I hope this provides a little bit more information for you so that you can see what we're doing. I also want to take this opportunity, if you are a therapeutic riding instructor who does not do hippotherapy, they do therapeutic riding. I have a bunch of roundtables, and this is part of a roundtable discussion that you can use for Path CEUs. You would just need to head over to my website, melissajeanpt.com, and sign up for the roundtables there, and you can get your free CEUs. All right, so let's get started in the fun stuff. So this was a video that I had pulled off YouTube. And the reason I really wanted to show it was it's really exciting to see how far we're going with all of this equine movement. I mean, look at all of the sensors on this horse. All of this is just giving us more information and more data to help the medical professionals really learn and hone into those skills of how we can really use horses' movement. I mean, just look at our hips. You can see the hips moving, her shoulders, her elbows, everything is moving. Here's even a better example of it. So when we're talking today about all the different developmental positions that we're, sometimes using on the horse and traditional positions, really think about that slide. Think about the movement that's happening. Because it doesn't just happen isolated in one area. So let's pretend we're now just going to talk about forward riding, most basic, simple, where everybody starts. But before we even get here, your therapist would be doing a tremendous amount of looking at your child and assessing and seeing what horse movement would be better and which horse would be the appropriate horse to partner your child with. So that is the groundwork that has to happen before sessions happen. But we're just going to pretend for this entire video that that's already happened. We've already paired our participant and our horse up beautifully. And so we can get started. So again, forward riding, most basic one. For all of the positions that we're going to talk about today, you're going to see that we're going to talk about the motor system and the sensory system. Sometimes that motor system, I'm also going to throw in some of the respiratory system and the digestive system, because you can't influence one without influencing all of them, which is really why you want to ensure that you are partnering your participant with a horse properly so that you can really get the biggest bang for your buck with all of these systems organizing. So forward riding. Let's look at what happens in the motor system. Well, they're going to have postural co-contractions. So it's almost like the stop start, right? Even if you just rock back and forth, or if you think about riding in a car and all of a sudden someone hits the gas pedal really fast and you have that backwards and then you have your forwards. That is going the entire time on these children or adults when they are sitting forward on the horse. It gives you a slightly more of a posterior pelvic tilt. This position requires less abduction and external rotation to get on. So if you have any of those kiddos that has really tight abductors or adductors, which happens a lot, it tends to be a muscle that we use to compensate when some of the other pelvic girdle muscles aren't quite firing the way that we want them to. It's also working on that head and neck, as well as your ankle and foot riding reactions. Because as soon as that horse starts walking, right, you have your back moments of posterior movement. What happens with their feet is they usually get a little bit of some dorsiflexion, right? They might even extend their legs a little bit. Everything that they're going to do is to counterbalance it. And these are all reactions that we have. We all keep some of them, and some of our reflexes and riding reactions start to disappear a little bit as we get older, especially those primitive reflexes, definitely. But this is a really nice way to get all of those systems kind of working together of like, hey, when this happens, this is how our body is going to respond. And again, we're letting these kids feel it. Not a lot of times they're feeling it. Sometimes they come to the farm, strapped into their wheelchairs. We unstrap them, put them on a horse. Now they're sitting there by themselves. And it's very freeing, but this entire time they are working so hard. And the visual system and the sensory system, when you're going forwards, you really get a chance. Your visual and your vestibular systems are matching up. And that is really important to know, just because it is very easy and comfortable for them. It can be a little jarring sometimes, and you'll see when we put them backwards, because all of a sudden that visual system is not meeting up with the vestibular system. And so they're kind of like, they're relying on proprioception and some of the other ones, which they might not be accustomed to. So you will see this little participant here. She's on a bareback pad. If you want to use a saddle, most people, therapists doing hippotherapy, choose to use bareback pads. However, just like we all know, we are all different. And sometimes you might need a saddle for a while if they need that biomechanical support or for whatever goal that you're working on. But just know when you do use a saddle, you are lifting them away from the equine movement. So it will kind of mute the translation of that equine movement to your participant. It does not mean that the session is not effective. Because if you're using a saddle, it's because you have thought about your list of goals and how you're going to get there. And maybe having them in a saddle for a while is part of it, which is totally fine. So why do we choose forward? It's a great place to start. Like I said, due to the sensory systems matching the motor system input, it's the most comfortable. Children have likely seen cartoons of people riding horses or seen people riding horses, and they're all sitting forwards, right? Most of the time. So it's a very comfortable place to start. It's the best place to couple the movement between the pelvis of the human and the horse. It's exactly where it needs to be. It's less likely to cause a lot of increased nervous energy, right? You can see some of the nervous energy when we're going backwards or sideways in any position. And you can understand why, right? It could be a little offsetting. But it really is just the most comfortable place to get started. Backwards riding. So motor systems, right? So when they're backwards, we're increasing that base of support because now they're not sitting as close to the shoulders and withers of the horse, which tends to be a more narrow area. Now their legs are going to be around more of the barrel of the horse. So now they're going to have a much bigger demand on that hip adduction. They're going to have to really bring it out. Their hips are going to externally rotate, hopefully just ever so slightly. It's going to place their pelvis in a slightly anterior position. And that's going to really vary depending on the withers of the horse. So this is where the conformation of the horse, again, remember, we've already set the stage. We've matched our participant and our horse. So I know when I put them backwards, what I'm expecting it to look like and the advantages of doing that. If you have a horse that has really high withers, just ensure that you know that before you go in and try. And if you have a horse with low withers, again, just know your horses, know their conformation, and know what it's going to do. Obviously, a horse with higher withers is going to give you more of that anterior tilt of the pelvis because it's really using the horse's conformation that's giving you that. You're going to see with backward riding an improved head and neck position. And again, it's a lot of that stop-start, but also because their visual system is requiring a little bit more effort to focus in on things because now again we've turned them around. The vestibular system is not matching the visual system. Some children, if they are very weak and having a hard time with like laterally staying on the horse, they might enjoy going backwards just because again we're bringing their legs even farther apart. Anytime you bring that wider base of support, it really makes them feel more comfortable. That's if they don't have sensory issues that are making them more uncomfortable. And you usually see that if you have a more narrow horse, those are always going to challenge the children or adults a little bit more laterally. The sensory system, again, that visual and vestibular input is completely opposite. It can be disorientating. It can cause discomfort. And I have seen sometimes it can increase the seizures. So you really have to pay attention to all of that and know why you're using it. If I am going to use it for a first time with, let's say, a new child who does have a history of seizures, and they might be still happening quite often, I'll talk it over with the parents. I'll say, listen, I'd really like to put little Johnny backwards. This is why. These are the reasons why I'm a little hesitant. What do you think? Has he been ever responded negatively to like being on a train going and sitting in one of the seats that's going backwards? Or tell me how he does on some other things. So I'll do a little more investigative work before I just go ahead and try it on the horse. You never want to try anything for the first time on the horse. And that's for the benefit of your participant and also your horse, because the horse is going to pick up on any of that nervous energy that might be happening. So why choose backwards? It really does help with children who do have gravitational insecurities, meaning they don't like to be off the ground. They have a very strong fear of falling. And that is because they have a wider base of support when they're sitting backwards. Again, this is not like black and white. It's very different depending on each participant. Improved head and neck posture. Now, again, I think that really plays into the part because so many of our participants that come, right? They kind of have the rounded back, they're collapsing, their head is forward, open mouth, and saliva management isn't sometimes best. But as soon as we put them backwards, we've now given them that anterior pelvic tilt, right? Because of the horse's withers. And what happens? It's a chain effect, guys. That pelvis is keystone always. And so it changes that angle and it goes all the way up. And all of a sudden the children are really sitting up, bringing their shoulders back, getting their chins back, and they're able to swallow. And it's beautiful. So you typically do see speech therapists do say that they do see better articulation and saliva management with the children backwards. And I do have to say, if you have them propped on their arms going backwards, it's really giving a lot of input into that TMJ and jaw, and which is so powerful for so many of these children. It gives you an increased area for upper extremity weight bearing, or even toys. You could, make a little game on there of, matching, stickers or putting your hand over one object. Because now you have the whole horse's rump to use and work with. You have that entire area. And it stimulates the lower extremity righting reactions. And this is really due to that disconnect between the visual and the vestibular system, because now we've taken away the visual system. They cannot count on that to tell them where their body is in space. They have to really rely on that proprioception. And so I love putting these kids backwards, and I'll put them backwards and then I'll switch them forwards and look for that carryover. Look for the carryover of like, oh, my legs, I should be using these. And then as soon as I stop seeing that carryover, we get right back backwards and I wake it up again. Hey, let's keep this up. And sometimes we're going to do that a lot. But guys, they're motivated to do it and they're using their natural reflexes. Like, how amazing is that? It's beautiful. Sideways. This is the very first position and the only position today that we are going to discuss that is naturally asymmetrical. Forwards and backwards provide symmetrical input, which I think you can imagine, right? If you're sitting on the back of the horse, you're getting symmetrical input right to left, right to left, right to left. Being sideways requires a lot more hands-on, a lot more thought process. You really need to have this all planned out in your head before you even do it in a session and know why you're doing it. Again, this is all done by medical professionals who are trained in all of this. And so they're able to make these, split-second decisions of what is appropriate for the horse and the participant. You're going to really be patient when you do sideways, and you're going to play with the postures. The slightest shift of weight forward or backward as they're sitting on that horse is going to give you dramatically different results. So let's look at the motor system and what's happening when we put them sideways. It encourages more of that lateral weight shift through their hips. It encourages postural co-contraction depending on the horse's body type. Again, you got to look at the horse's conformation. Because the horse's spine, sometimes some spines are more prominent, right? So, and you'll see in the next slide, it can almost look like they're sitting on a triangle sometimes, depending on the horse's conformation. So if you put them at the back side of the triangle, they'll be sitting up further. If you move them too far over, you're going to encourage more of the slump. So it's really playing with the biomechanics of the horse and how it affects your participant. It's a great place to integrate primitive reflex patterns. And that is because if you have the child facing the therapist can really get in there. And as soon as you start seeing some of those primitive reflexes that we tend to see when we start challenging these nervous systems, those primitive reflexes kind of come out. So it's really a great place to do that. And the sensory system, well, the vestibular and visual system can be matched. And that's going to be really different for each participant. Some participants really want to focus in on the therapist or the sidewalker. And the other ones are like looking like, oh, where's the horse going? Where's the horse's head? And they need to orientate themselves. And so you kind of have to play with that. And if they're rotating themselves, are you really getting what you were thinking you wanted? Is that really giving you the input that you were hoping to get for that participant? So like I said, it's really like sitting on a triangle. And so with all of that, why are we choosing sideways? Well, we typically will first off use it when we see asymmetry, but we want to encourage symmetry. So some of our participants who maybe they are hemis or they have one-sided weakness or anything along those sides, or they even have some torticollis left and you want to get them righting that head in a different direction. You are going to put them sideways because you are going to then overemphasize what you want, over weight shift, give them more input into the area that you want to facilitate. We want to wake up the system. But for some of our participants that backwards would be too much, this is a great way to do it. It really heightens up a lot of their sensory systems. And it really does encourage more of an upright sitting posture. But again, you have to be looking at the conformation of the horse. You need to be looking at where your participant is sitting. You need to have trained sidewalkers and leaders and handlers to help you along. So now we're going to look at just a little bit of sideways riding here. First, you're going to see him getting into it. And this young gentleman is amazing, and he has some contractures in his upper extremities. And so we really want to encourage him to get his hands down. And this is a great way to do it. Sideways is wonderful for him. He naturally wants to keep his arms out to his side. And so this is kind of giving him the encouragement of, oh, hey, I can use my hands, with the hope that he will start to bring them more midline along the way. But you can see as the horse started moving, he had that moment of going to the back of the horse and then coming forward again. And this whole time he's playing with that posture. This horse tends to have a higher backbone. And so, the muscle girth around her spine isn't as great as it had been in the past. She's getting older, and which is why you'll see some extra padding on her. But even with the extra padding, side sitting on her is pretty hard. And he's doing a great job. And here he goes in the other direction. And again, you can just go ahead and take a look at the way he responds when the horse starts moving. Now you can put games with them going sideways, anything, but most of the time I just say to the kids, hey, do you want to be a circus clown? We can do some really fun stuff. Get ready. And then as we're going past their parents, because sometimes their parents get nervous, say, don't worry. He's trained. He's good. And everybody laughs and it's great. But yeah, you can see just turning him sideways, he's using his hands so much more, which for him is part of the goal. It's part of the entire process. So the horses are amazing. Partnering them with people is amazing. But always, always, always remember, guys, your horse is back. And I love this happy horse training because it's so, so, so true. If you are not symmetrical, which none of us are, but if you have a really true asymmetry, like in some of the participants that we treat, they are not only crooked themselves, but they are going to be giving that horse not symmetrical input. And so remember, if your participant is off-centered, so is your horse. You can break up the tasks so that both the participant and the horse have a little bit of a breather before you continue, especially if you know that your participant is struggling with an activity that you're giving them. That also means that your horse is probably struggling to stay underneath them. And so giving them breaks, it's a very kind thing to do. And I promise that it will come back to you tenfold in your results. By just giving the children and the horses times of rest so that their nervous systems can kind of adjust to what you're asking, you're going to get such better results. And your horse is going to really appreciate the decrease of pressure for a little while. That's how you reward horses, taking away the pressure. And so by taking away the pressure, you're saying, yes, I understand this was hard, and now I'm going to take away that pressure. And again, the client will also really, really appreciate that. And I just want to thank you guys. Some of the positions that we don't talk about here that I talk about in the mentorship programs are quadruped. And you can see this young, amazing little man is in a figure 4 while he is sideways on the horse. And these are positions that are above and beyond the typical non-traditional riding patterns, and that we talk about in our mentorship program. And I want to thank you all for watching. 2021 has been amazing. I have met so many people and clinicians and centers all around the world. And it's been amazing. And Path International has just approved all of the courses, the free ones and the ones that are $40 for CEUs, which is really exciting. And just as a thank you to everyone for 2021, I'm giving 50% off all of the Posture Perfect course and all of the problem solving calls with me. And as always, the roundtables are free. So just use code roundtable at melissajeanpt.com And I hope to see you guys there. Thanks so much for watching.